So the difference between a spinal fusion and a disc replacement surgery, for the first part, is essentially the same. So the problem is that you have a compressed spinal cord or a compressed nerve or a damaged disc that's causing severe pain. So the first part of the surgery involves going in, making a small incision, and removing that damaged disc and removing the pressure on that nerve. Once that's achieved, patients really tend to feel pretty good because it's that pressure or that damaged disc which is causing the pain. The question is, what are we going to put in that disc space? So now you have an empty space and something has to go into that empty space. Traditionally, you'd put a block of bone or a small cage in a plate, and the two bones in between the discs will mend together and grow into one bone, and that's a fusion. The arthroplasty involves, rather than putting in a block and fixing the two bones together, we put in an implant which is made of similar materials to a hip or a knee replacement. And it sort of mimics the biomechanics of a disc, and it allows for motion. So the discs don't get fused together, they're able to move. And there are some big advantages to that. Another thing in terms of post-op recovery, when you perform a fusion, you lock the two bones together. They need to be held very still and they need to grow together. So commonly, your doctor will give you a collar to wear, which sort of restricts your neck motion for a while the bone mends. And in arthroplasty, that's not necessary because we are not fixing the bones together, we're putting in a moving piece. So no collar, we want range of motion as early as possible.